All right. Welcome, everyone, and thank you for joining us today. I'm Becky Wei, Chief Strategy Officer at VSee, the digital health platform trusted by GE, Centene, McKesson, and even NASA International Space Station. Today, we are diving into one of the biggest pain points in healthcare clinical documentation. It's the most time consuming part of a doctor's day and one of the leading causes of burnout. So, if you ever felt overwhelmed by charts and paperwork, you're in the right place. Because today, we'll talk about how AI can give that time back to you. But before we get started, just a few housekeeping reminders. This session is being recorded and you will get a copy afterwards. And we'll be taking questions throughout the session. So please drop your questions in the chat as we go because we want to cover all the questions that are important to you. All right, for today, we have two speakers. The first one is our very own Milton Chen, co-founder and CEO of VSee. And our special guest speaker is Dr. Ramon Lazaro, founder and CEO of Tele911, a national leader in virtual emergency care. Under his leadership, Tele911 has completely reimagined emergency care. And their recent breakthrough is an AI solution that reduces charting time from 15 minutes down to 1 minute, giving back 14 minutes for every patient. So today we'll explore how they did it and what it means for the future of emergency care. But first, a fun fact about Dr. Lazaro, he can read lips because he used to be deaf. So when people forget to unmute themselves on the video call, he still knows what they are saying. So next time, be careful what you say on mute because you never know if someone can read lips like Dr. Lazaro. And for Milton, something you might not know about him is that he loves adventure and likes to travel to extreme places. He's been to the base camp of Mount Everest and driven across Lebanon and Syria. Dr. Lazaro, Milton, we are so honored to have you today. Welcome to our webinar.
Thank you, Becky.
Thank you so much.
All right, okay, let's start. I want to start from the very beginning. So every change leader who drives bold innovation starts with a clear why, right? So the belief that drives what we do and how we do it. So Dr. Lizardo, what was the driving force for you and your inspiration for founding Tele911?
Awesome. First of all, thank you so much for the invite. Above all, to this podcast, I feel like I'm doing a podcast with a friend because Norton is a friend of many years, and what better way to celebrate our friendship by being able to share our knowledge together. But Tele911 really it was an idea that was scribbled in the back of a greasy napkin. What if people called 911 and actually got a doctor? Right. Now, here's the thing. When this idea was scribbled, it was a little bit over 10 years ago. So I'm a physician by training, but I've been in tech for about 15 years. And a lot of the reason why I left is because what we were practicing wasn't emergency medicine. If you look at the landscape and how people use the ER in the US, it's a lot of primary care. And I realized these people should have stayed at home. They're actually doing worse by going to the hospital, missing their meds, being exposed. And the idea was, hey, what if people called 911 and got an emergency room physician? Throughout the years, it was tried a few times. I failed a few times, and it wasn't until COVID happened. And then this idea that was a failure was an automatic success because it was a clear need to keep people at home and not expose them to the elements that they were exposed to. And because of that now, just 4 short years, I mean, we're now the leading company in ER diversion across the US and one of the largest national providers of emergency medicine. And that's thanks to our patients, our health plan partners, but also our technology partners who believed in us early on and said, yes, let's do this together.
Right, thank you. So Dr. Lazaro, now tell us more about Tele911's model. I think it's very interesting, the integration of live ER certified physicians with first responders. And why does it matter in closing the gaps left by traditional emergency care?
Excellent question. So our model is quite simple. When people call 911, which they naturally do over 500,000 times a year, right? The MO is, hey, ambulance shows up and takes them to the hospital. What we've done is we've intervened in the natural process of how they do things. Yes, they will call 911. Ambulance would show up in about 6 to 7 minutes. But instead of being taken to the hospital, in 80+% of the time, those low acuity calls, what they're brought is a board certified emergency room physician via an app. So these $1 million ambulances that are showing up to people's houses have the ability to do everything that they do at the hospital, from EKG to blood work to IVs, but they need the infrastructure with the emergency room physician in order to be able to triage that. So by putting technology in the hands of the medics, what we've been able to is for them to be able to treat the patient and practice at the top of their license, but also go back in a more efficient time and treat the real emergencies. So when those real emergencies are calling, they now have a pathway in order to be able to service them.
Very cool model, yeah. So now I'm curious, like, how did you choose a technology partner in executing your vision?
That's, and I mean, and Becky, this was going to make or break our business early on, right? As a matter of fact, there's a version of failure in this even early on. So we initially started with the wrong technology partner, and people would press the button and
Mm,
nothing would happen. And the truth is this: when it comes to innovation like this, you only get one chance, right? And if you press a button and it doesn't work, you're assuming that it's never going to work. You're going to
yeah.
tell all your friends it's not going to work. That's
Mm-hmm.
what happened in the beginning stages. And then we said, hey, we know the idea should work, but we
Mm-hmm.
need to look for technology partners that are going to be able to service our idea. And that's where Milton Chen came in. And by the way, I went to him and pitched him the idea, but I really needed him to take a risk on me, right? VSee was already established. VSee was, I mean, there's such a trusted platform. NASA trusts them, right? McKesson, like all these top name brands. And here I am with this idea, with failed execution, knocking on his door and saying, "Hey, would you take a risk on me?" And the amazing part, and this is why I feel like not only are we great friends, but just really great partners together, is that when Milton sees a vision, he
Mm-hmm.
latches onto that vision and says, "Hey, together, let's go out and make it come true." And that goes for small companies and big companies, right? We
Right.
were quite small at the moment, but we were able to execute up to this level now. So knocking on his door and saying, "Hey, would you take a risk on us? You know, you're a gorilla in the room. We're nobody, but would you?" And him saying yes was a huge validation for
Right.
us at Tele911.
Okay, so Milton, why did you take a risk in partnering with Tele911, right? Because like Dr. Lazaro said, like they were just a small startup, right? So tell us why.
I appreciate it. I think there's really two reasons in there. The first one is I think if you look at the problem that Taliban women solve is a massive critical problem that I think all Americans, I mean, you hopefully you never get impacted, but when you do, you really wish to have that in there. Right? I feel like also we can approach like to be honest, like startup on the daily basis, right? People are so over the past, I guess, 10, 15 years, almost developed a pattern matching in this, right? So I saw what he's doing, I think in my mind at least there's no doubt, right? He's going to be a multi-billion dollar enterprise. It's like a surgeon, right? The problem he's building is so important, is so critical. I think that gives me personal excitement. I would love to play a small role and a company that go from start to billion dollar. That's really good. Then the second reason was I think for the people who follow Ramon on LinkedIn, right, he's just a natural star, right? If you hear his story, meeting his wife on medical mission, all these things, just like incredible individual, right? Sometimes when you meet this incredible individual, you just like say, like, I gotta work with this person some way because it's just like that personal joy you get that. Because that's the two reasons. And I'm incredibly happy with this, not just able to support Taiwan and also the friendship over the years and so on.
Well, I love this story. I mean, that's a saying, right? Higher the risk, the bigger the reward, right? So yeah. So want to talk about AI because, like, for clinical documentation, it has always been one of the silent weights in healthcare. It's time consuming, repetitive, and often, like it drains energy and it also steals time and attention away from caring for patients, right? And then for decades, like doctors have accepted this as just the way it is. But what if it doesn't have to be that way anymore? And then what if AI could lift that weight? Not by replacing physicians, but by giving them back the time and the focus that they deserve. So, Dr. Lazaro, could you please walk us through how Tele911 uses AI doctor notes from the moment a physician speaks and all the way to the final note, and how does that look like?
Absolutely. And I think first, I mean, before I show you how we use it, I think we should take a look at what the problem was, right? That we were trying to
Okay.
solve. So as I said before, Milton takes a risk on us. We started this company, and little by little, we started growing. We're now in our fourth year, and what we grew to the nation's largest virtual ER. We cover over 10 million patients, and what happened with this level of volume is if you don't optimize, you actually start losing so much money. Like our encounters last about 10 minutes. But if our physicians are spending 10 to 15 minutes documenting, it's a problem. And the reality is this, that is not uncommon across the US. As a physician myself, I can tell you, we were spending more time in front of the computer than with the patient. And that is across the board for all types of clinicians, whether it's an LSW or a psychiatrist or an emergency room doctor or even a surgeon. And what we're seeing is we've trained for this field to be able to interact with patients, but we're spending so much time protecting ourselves by documenting correctly that we're losing the love of that encounter. Right. As a matter of fact, I can so see some doctors that are great documenters, but terrible physicians with bedside manner. So we had this issue that we had this amazing volume and then this backlog of even our own physicians saying, hey, I left the hospital to work for you. Now I'm seeing all these patients, but then I'm spending all this time documenting, right? And I came to Milton and I said, hey, we got a good problem, but we got a problem. And if you look at Milton's background and Erica's engineering team, they're mastermind. I mean, they were talking about this years ago, and what they built was a solution that it solved the operational problem for us when it comes to documenting. But what it did, it gave more life to the company and to our physicians. Our physicians now, when they join a call with the medic and with the patient, over 90% of our calls, our physicians are doing this. They're literally, I look at the QA videos and they're all folding their arms. Nobody's taking notes. When was the last time you walked into a doctor's office and he wasn't carrying a notepad or typing away?
Even look at you, right?
Exactly. Over 90% of the times they're doing this. And that brought so much relief to me because what that was telling me is they're trusting the system and now they're just able to engage with the patient. So automatically the system sets off where they join the call and it's already transcribed, right? And what it does is it generates something called AI SOAP notes, which is structured notes based on the conversation and the encounter, right? And to put a better picture in this is imagine this conversation and then you're getting cliff notes out of it, but in a clinical sound way with also codes that tell me what I need to bill for. So our physicians then wrap up the call and in less than 1 minute do 2 clicks and submit because everything's done for them from the transcription to the QA to the SOAP notes generation to the sending and signing. And now those 15 minutes that they were going to spend, now they spend it on another patient doing the same thing. So before they would spend, if you worked a 12-hour shift for us, let's say you saw patients for 11 hours, but then you block off 3 to do notes. Like now you can literally spend out of those 12 hours, spend 11 and a half hours just seeing patients, and then the rest is clicking away. And
Yeah,
that's what they solve for us, which is fascinating. But more importantly is this too. On the empathy side, our patients are telling us, hey, these physicians are alert. They're paying attention, right? They're not away. They're not distracted. They're engaging,
yes.
right? Which is so critical in this stage of building that trust through video. And that's what this product has been able to do for us.
Amazing. So patients are feeling like, I got the quality care, right? The physician, I got the 100% attention from the physician. I love it. Yeah. So for Milton, so from the technical standpoint, right? Like what were the technical or regulatory challenges you and VC team faced in building an AI solution that is both accurate and clinician friendly? Because we all heard that, right? Google's healthcare AI model making up a body part that doesn't exist.
Yeah, Becky, thanks for that question. I think there were basically two bucket challenge in there. The first bucket is definitely regulatory. You probably saw Sam Altman open AI ChatGPT, recently talk about like if you try to do anything mental health on ChatGPT, do not assume that's private conversation in this, right? So from a HIPAA perspective, of course, that's completely okay. So one of the things when you do AI, you have to be very careful was like, are you using any underlying building block? Is your underlying model, is it for healthcare or for non-healthcare? Because of course, when you do healthcare, there's a HIPAA, all these things. So that's how we think we're, again, so the part of the VC, because only thing we do is healthcare, our stack from the ground up is everything about security, HIPAA, and so on. Then the second part you mentioned about like the Google's, making out parts, the hallucination effect.
Yes.
It is a general problem for AI in general now. The challenge for that really is about, are you focused on this, a particular domain in this, by able to laser focus on a domain. So the end of the way you do is you do this called a long tail problem, right? So you deploy something, you have issues, you just quickly solve this by solving the long tail problem. You actually will refine something that's get better and better with every release. Again, I think there's no magic formula in there other than just like toss a bunch of engineers and just like beat their heads on it.
Great. So, Dr. Lazaro, in the beginning, how did your physicians respond to this change? Were there any challenges in implementing or the workflow integration?
Yeah, well, really excellent question. So the good thing about the partnership with VSee is that they made everything so seamless. The training for our physicians to use this was literally just an email
Oh,
where, hey, now you have a button, press the button, and it's going to do the work for you. Right? And I feel like training in healthcare needs to look like that. All right, not a crazy manual, not a protocol that's insane. Because
yeah.
people forget, people don't want to change their ways. It has to be simple, stupid. And I'm so grateful that VSee made it in a way that the training was literally just an email. Now, initially, as with all new things, some of our physicians started asking, "Hey, wait, someone's listening to my conversation. Well, how is this accurate? Right? Remember, clinical documentation. It's a potential lawsuit or savior for you, right? It would either protect you or get you sued. So they had to figure out, well, can I trust this? Is this going to provide the outcome that I want it to based on my interaction? And what we've noticed is the first few days, everyone was trying it. But what happened was a few leaders started saying, yes, it works. And then it catches like fire across the board. But again, the implementation was critical. The fact that it became so easy was so powerful for us. And AI can seem scary, but if you make it easy to use, it's way more palpable for everyone in the room.
Yeah, so basically making it like very simple, very intuitive for the physician, then they would definitely use it, right? So Milton,
one more thing though, Becky, is the notes were better than anything we could write. So, and I think this is something we really want to consider in AI. So the information is taken across the conversation and generating accurate notes for that. If I'm taking notes and writing them down, I can forget different aspects of the conversation that in the
Yes.
long term might be the critical aspect that would protect me, right? And if it's
Right.
not documented, it didn't happen, right? But the fact that there's a transcription that it feeds out of, it actually highlights things that we didn't forget. And at times, it even captures things that we misheard. And I
Right.
think this is why AI actually makes us better clinicians. This product has not only protected our clinicians at the company, but our physicians are now looking back and saying, oh, wait, I think I missed that. They're expressing a neurology issue. Let's double click on that and make sure that they have everything they need.
Wow, this is not just an insight. This is the truth that we are living in these days. So, Milton, from the technology partner's perspective, so what helped physicians start using this like right away? What kind of changes, either in design or user experience, that made it easier for them to use?
Yeah, so like I think sometimes Ramon almost answered this question from his perspective already. If I were to add my 2 cents, so is from the engineering perspective, it's very easy to instead of one click, you become 2 or 3 click in this. I think this is really about that we as technology product people, you need to try that. This going back to the days I was a graduate student, right? People talk about every extra click, you should expect about 20% user attrition. Of course, once you add in a couple of clicks, that's how to become enormous. I think this again is how do you create that one button? How do you make sure that's all you need? Another area where we're investing a lot of effort on is really based on what Ramon says. Like, for example, I think the AI can not only save physicians time, but you can create these automatic checklists, even things like for prior authorization, here's a particular payer, what do they need to cover? Like, where's another interesting insight? There's tons of stuff where I think it's almost like when I think about AI, right, you put Ramon, a physician like him, he's a superstar physician at the core. How do you wrap them around with such a AI to just save their time, let them do what they do great?
All right. Thank you. Thank you. A reminder for the audience, please feel free to drop your questions throughout the webinar. We will take your questions. All right. So we're going to move on to the next topic, which is the impact. So we know that reducing documentation time by 93% is not just a data. It's a human success story for us, right? So it means real patients, real doctors experiencing real change. So in a world where healthcare is stretched by shrinking resources but rising demand, these outcomes, they matter more than ever. So Dr. Lazaro, can you share the impact that you have seen on clinical capacity, on patient care, and also on provider workload?
Even though VSee is a technology partner and this is a technology, at its core, what it really is doing is giving back life into healthcare. In a place where a lot of this has been, I mean, documentation has sucked the life out of healthcare across the board. And little by little, it really has turned into how well do you document instead of how much, how well do you treat this patient? But so for us, as we scaled the company, what I realized is, and I think when I first talked to Milton, I said, I think I have a problem that's 2 billion minutes. And it sounded weird, but what I was doing is I was calculating the amount of minutes that our physicians would have to document at scale as we continue to grow the company, and what that would cost us, what that means for capacity, how that would be a bottleneck, how sustainability wouldn't be, especially with Medicaid patients, sustainable. We wouldn't be able to build the company that we have now, right, with such healthy margins if we're spending all this time documenting and paying our doctors for it, right? So that's the reality. This is a multifactorial problem of not just burnout, but also a fiscal problem. If you're not using this, you are losing money, right? Like, that's the reality of it. And we have to see it as that. And as a CEO, I have to see it as that in order to protect the company as my job, right? So when it comes to the clinical capacity, what I see is this. Those 15 minutes is an extra patient that every doctor is seeing, sometimes two patients that every doctor is seeing. That's additional revenue in exchange for 1 minute of cost, right? And that in itself pays in multiple folds in and of itself for the technology, right? When it comes to the burnout issue, like remember, we built the nation's largest virtual ER because people were tired of going to the hospital and documenting over and over again. The best example is if you go back to college and you have a computer at home to write your paper, but you're still walking to the library at college and using the college computer to write your paper. That's how the hospital feels, because you're going there to see a patient and documenting one. So we knew that we started this innovative model. We were allowing people to work from home. But we knew that if we created the same environment at the hospital where they're documenting already, they were going to leave. Right. So, and as the company matured, we knew that we didn't stand a chance against this industry juggernaut that no one had solved yet. So when we released this and we saw our physicians do this over and over and over again. Now, the first few calls, they were taking notes because they were like, I don't know if this is going to work. But by the second call, they took less notes. By the third call, they were like, And now they show up and they're just like, hey, I'm ready to talk to you. I'm ready to figure this out. I'm ready to see what's going on behind you. So when it comes to the capacity, yes, but when it comes to the burnout and how it makes physicians feel about their career and their work and their value, that's just hands down the best. But on the flip side too, one of the things that we must include is the patient. Patients aren't being paid attention to because doctors have to document, right? So when we're getting these feedbacks from these patients about, wow, these are some of the most attentive doctors that we've ever seen, well, it's because of this tool that's allowing them to practice at the top of their license and simply engage with them, right? And that's what I believe is the new standard of healthcare. It should look like this. People folding their arms and saying, hey, let's just have a conversation.
Great. Yeah. So relating on that topic, we have a question from the audience from Mikkel Daniels. So we all know that there are hallucinations. So if you are just clicking save in 1 minute, how are you accounting for this? Is that a way to check the AI?
Okay, maybe I'll take a shot. So for this hallucination, it's unfortunately it's just based on the underlying nature of this generative AI. So it's a universal problem across every single models in this. So what you guard against is really about just like laser focus on your domain. You need to have a continuous feedback loop on the quality. What that does is that will allow you to, and by that, a lot of these for AI model on the underneath, there's a parameter you can tune to the degree they will be creative, if you're quote unquote creative, right? So you could tune that level to on the low end in this. That will decrease away how creative you can be in this. Again, it's one of those that there's not a magic, there's not like a one magic solution. Other than have this sort of continuous feedback loop.
Yeah. So regarding that one, this is something I learned recently. There's a thing called lethal trifecta. When you're using AI, you need to make sure these three things. One is the access to the external. The second one is the exposure to the untrusted content. And then the third one is the external communication. So make sure you can use two of them, but all three together, that's a really big safety risk. So if you close your loop, like Milton said, right? Like a closed domain, then we can train, we can develop it further. All right. So Milton, so the next question for you is, from the VSee platform perspective, beyond time saved, what other quantitative or qualitative metrics are you tracking after implementation?
Yeah. There are two big areas we're tracking. So the number one thing we're tracking is users' feedback or complaint in the so we as a company, but there are many different these were AI nodes company, right? There's some huge players, from Microsoft, all these, right? So we're in some sense, well, how we differentiate from those, again, be laser focused on the specific domain in this. I think this is where you can solve a lot of these AI issues by that. So again, just, like anytime when Ramon or any of his physicians amazing complain, this is where we jump on top of it. We figure out. So we think this is our number one thing, just making Dr. Lazaro super, super happy. Then the second thing we track is actually compute or response time. So one of the challenges with these AI is when you click on that button, it's not like that, right? So unfortunately, there's a lot of compute that has to happen in there. So we're constantly looking for a way to shape that time lower. So because I think unless you get that click a button, get that instant response time, you always create a little bit of friction on how they use. Again, that's a two big area we're tracking.
Yeah. But Milton, I must say, if it was slow, my doctors would have already complained by now. So at least the response time is quite fast, because we would have been like, this takes too long, we're not doing this. So it's quite fast.
Okay, right. Thank you. All right, so we're gonna move on to the next topic, scalability. So with success in one setting, the natural question is, how far can this kind of breakthrough really go, right? So healthcare is under pressure everywhere. Policymakers and health system, they are looking for solutions. So let's talk about the future of AI documentation and how we can scale it and then what comes next. Milton, this time let's start with you. How scalable is this approach across different specialties, demographics, even the EHR system, integrating with the EHR system? That's the question from the audience.
Yeah, I appreciate the question. I would say in my career, I have probably interacted with thousands of physicians. I have never met a single physician who says they love documentation. So I think for this, it definitely there. In fact, I would say if I fast forward a couple of years from now, I will be shocked to find any physician who still do this. I just think like it's going definitely. There's no intrinsic reason why you wouldn't scale in this. And in fact, for part of the integration with EHR, all these, right, these are all solvable problems. In fact, one of my prediction is, this may be slightly controversial. You probably saw that Epic, Judy, they just got a $30 billion offer, so she turned down in this, right? Epic, amazing. Then Oracle, through the certain the massive in there. My guess is within a couple of years, how you interact with EHR will be all AI driven. No longer the traditional way, let me pull up this thing, search all these, all that. I think we just like, in fact, I think that all the user interface you see in the current EHR, they will all be sort of phased out. Again, I'm pretty bullish on AI for everything.
All right, great. Thank you. All right, Dr. Lazaro, so looking ahead, do you see this AI documentation model expanding beyond virtual care? How about in in-person clinical settings or even other parts of the healthcare workflow?
Well, absolutely. So this was our first array into AI. And what we've seen is slowly we're becoming an AI company first. Everything from our billing now. I mean, by the way, this feature that VSee just launched does generate CPT codes. Now we're tracking revenue, additional revenue that we were missing out on because it's generating more accurate CPT codes on the complete visit, right? Now we're using AI for submission into into billing, right? What do I do? What I do believe is that we're going to go both ways now, right? Downstream, after documentation, but also upstream, right? As a company that handles this volume of patients, right, across the nation, one of the things that we need to start figuring out is, how do we triage with AI? How do we prioritize? As a leading company in ER diversion, who should be first? How fast should it be, right? So what we're seeing is we brought in and trust AI and what it can produce, right? With clinical oversight and a human involved. We are seeing it downstream optimize our company and make it a more efficient and valuable company. And we plan to use it upstream in order to make sure that we're providing the best care to the patients with the right clinical outcome at the right time every single time.
Great. All right, we have a really good question from the audience. This is from Mark. Are you promoting an AI scribing platform? Are you encouraging the use of some type of AI note transcribing, or are you telling us about your business Tele911? Do you recommend any AI platforms for psychologists?
Yeah, that's a good question. So I do want to state this. Milton does not pay me. I do not promote. I'm a clinician first before I'm a CEO and a business leader, right? And because of that, I've turned down a lot of opportunities for tech. I'm a clinician first and I would do what's right for the patient. Am I promoting AI Scribe? Absolutely not. I'm promoting a tool that I use that scaled my company and that I trust. I have not vetted every other tool out there. I do not trust every other tool out there. I am very risk adverse and I have to be, because that's how every organizational leader should be, right?
Okay.
Question everything. Doesn't matter how much revenue they're doing, it doesn't matter. Question everything. And like I said before, like I am responsible. I cover 10 million patients. One patient gets a bad experience and that can destroy not only my reputation, my company's reputation, and also the industry that we build on ER virtually, right? And what I'm saying is this. I trusted VSee to build something. What I've seen is it's delivered beyond my wildest imagination. So do I support all AI Scribe? No. I actually know a few top name companies making a lot of mistakes. And that is scary because those are people's licenses there, right? What I am saying, based on what we've seen and our data, I at least can put my name behind VSee there. And then the second part of the question was, is there a recommendation for psychology? Was that the question? Yeah, and like here's my theory across this. If this tool works on an emergency medicine visit with the loudness of the background of someone's home, an EMT plus sirens, right? And a doctor in a third location, and yeah, it can be trusted, then I think it could be trusted with psychology or primary care in a quiet setting where you're on one-on-one, right? And I think it's true. Like we were the true testament of a test because, I mean, it's a different scene every single time with every patient encounter, right? Plus three partners in the room. So if it worked for us, it should work for psychology, but also many other specialties across the board.
Great. Yeah. Thank you. And this question is for Milton. Milton, you already answered about the EHR system. This is a follow-up question. How do you address EHR accessibility and multiple database connectivity challenge?
Yeah, so I feel like my answer might be slightly controversial in this. I think it's definitely not a technology issue, because from the technology perspective, there's open standard you can make from data integration. All these are all solved. I think this is more is a business challenge. What I mean is naturally a lot of vendors out there, they want to protect their data, make it almost create friction to connect to different systems in there. My guess is this might be one area that require either the hospital, so they have to pick vendor that making be more open as a requirement. Otherwise, I think it's always going to have a little more. Again, like I said, this is not a technology issue. Like all the API there's in there. So like on the VCN, right, we can exchange data through all sorts of different systems in there. Often when you do this project, it takes maybe 1 day of work on the engineer, because spend like 3 months in meetings and waiting to get permission to do it.
Yeah. So Milton, do you integrate with EHR system like Epic?
Yeah. We spend a lot of time with Epic, Cerner, we're a big part of our engineering cycle is sit on those systems. We're pretty happy to support. Yeah, we support all the big name EMRs.
We have a lot of good questions in the chat right now. And then another question is, do you customize templates for different specialties like psychiatrists?
Yeah, you have to do customization there. Like I said, if you go to think about AI, right? On one hand, you have the Googles, you have the ChatGPT or OpenAI, right? What's different is if you do a general model versus domain-specific model, you can always do much better by being domain-specific. Then again, so I think customization is not just nice to have; is you must do.
Okay, another question. This is really good. So, there's a barrier we've run into is a patient's consent, right? So patient consent is a bottleneck to the streamlined implementation. So how can we streamline the patient consent?
I think you have to do, how like if you go to every doctor office, right, they give you the HIPAA form in this. I think it has to be just added in there, just a standard part of HIPAA in there that give consent to that. Otherwise, yeah. I think,
actually, to make it, your platform has actually made it easier for us to do patient consent. Historically, we had to put that in the EULA and have them check a box and do that. Now we have a video and a documented transcription of the patient consent. Now our doctors can literally just show up and ask for consent and it's documented. You just eliminated an entire step and made it easier for us to capture that both ways.
Yes, just to add on that, VSee, we have digitized the patient consent, all the patient forms that they need to sign into the workflow, so they don't have to do work on the extra time. When they see the provider, we can make it as easy as one click, sign it electronically. So we do have that. Okay, and then one more question. These are really great. Are there examples of VSee Tele911 partnership benefiting the underserved or under-resourced patients populations, either here in the US or in other countries?
Yeah, absolutely. So I'm going to give you an example of something that we're incredibly proud of. But by the way, every major city in the US that is powered by Tele911 with a clinician in under 40 seconds is powered by VSee. Right? So everywhere from Baltimore to Dallas to Sacramento, all these major cities, they have access to a board certified emergency room doctor in under 40 seconds and is powered by VSee. But I want to bring into light the Baltimore example because I think it's really critical. Every election season, Baltimore is used as a pawn politically because of the disparities there and the amount of Medicaid, right? With our partnership, Baltimore, the city that was used as a political pawn, now has access to a board certified emergency room doctor in less than 40 seconds. Every single underserved resident in Baltimore has access to that. So it just goes to show the power of what two people with crazy ideas, they come together, they build these companies, and now they're changing the healthcare landscape of what an entire city can look like. And I think it's just a testament to that. But Milton, I'll let you share more about what you're doing worldwide.
Yeah, in fact, Becky, when I first met Ramon, that was one of the things is about when you can virtualize the 911. Right now, you can easily, it's about covering the underserved, whether it's Baltimore or all these places across America who doesn't have this access in there. Right now, it's now through Tele911, you get this access in there. This is why when I mentioned at the beginning, I think he's going to have $1 billion company where I'm really, really certain about. And I think from that 10 million, it's going to be 100 million people coverage within the next pretty shortly. I think the same model can definitely apply internationally. In fact, Ramon and I, we've been doing some planning to how to take this same model, whether it's in the Philippines, in Africa, Latin America, there's all sort of, again, that same model of care, I think definitely apply, not just America, but globally.
Yeah, for VSee, we have done a lot of humanitarian medical missions in very remote areas like, Iraq, Syria, anywhere you name it in Nigeria. So if you're interested please check out our website. We have a lot of stories about that.
Yeah, in fact, Becky and I went to Iraq. She has a really great picture from Iraq.
Yeah, we were in the Syrian refugee camp in Iraq. So yeah, we have a lot of telemedicine, telehealth appointments in very remote areas. So please check out our website. Before we move on, I really want to ask this question because it's important. Dr. Lazaro, you have already covered this, but I think it's worth to do it again. How does AI documentation work?
Yeah. So AI documentation works at the point of the encounter, right? The doctors go to the visit, they engage naturally with our patients, they close the visit, and within seconds, that visit is transcribed and AI SOAP notes are generated. That's the power of VSee. It's able to do this instantaneously after the visit is closed. The doctors are then able to review the notes, which only takes a few seconds, and able to submit forward. No longer are they having to go back and forth, writing things out and things like that. That process takes less than a minute.
All right, great. Okay, I said one last question, but one more. This is really good too. This is a very basic but very important. Should patients be explicitly informed when AI is used in their documentation or care process, and what level of detail is appropriate?
Well, I believe that's a really good question, and I think that question in 2023 and 2024 would have been more appropriate. I think in 2025, I'm surprised that the patient doesn't use ChatGPT themselves, right? We live in a world, especially the second half of this year, where AI is all around us, whether we recognize it or not. I have elderly parents. My dad is 80 today. He knows about ChatGPT, right? This is the world that we live in. So the expectation is that naturally AI is going to be used around them. Patient consent across AI, it's not going to be, or my belief, it's not going to be something that's going to be a bottleneck, right? How information is used and the critical nature of security and the information, which is why we chose them as a partner for a healthcare company, right? It's what's critical. And that's usually what patients care the most about. How will my information be used? And this is why you have to pick a trusted partner. And I say this all the time. There's a lot of people in the space. Choose one that you trust.
Yes. All right.
Yeah,
Thank
if
you.
I can add there, so I think there's a HIPAA, which is really the underlying regulatory framework in there. So I think AI does not change it. So just because you do AI, right? So your HIPAA, you have to be, cognizant and follow all of those in there. Provided you're within that framework, you should be all great. Then the second thing is just build on Ramon was mentioning is I feel like if your physician is not using AI, to be honest, I will be a little bit worried. It's like just there's so much knowledge in that. I will prefer to work with a physician who's all in on AI because I think AI is not meant to replace physicians. They could definitely make things a lot more better outcomes.
As a matter of fact,
Yeah.
AI makes us better physicians. Literally, everyone's afraid. Oh, not everyone's afraid. I take that back. There's a lot of fear of AI, and what we've experienced is better physicians, better patient care, better quality of life, better outcomes, better operational value. Like AI has transformed us into a better company,
Yes,
and I
that's
truly see it across the board.
yeah. That really reminds me of this saying from Mark Benioff, the Salesforce CEO. He said, "We are the last generation to manage only humans." So I really like that quote, right? So whether or not you like AI or not is happening, right? Everyone's gonna use AI sooner or later. So you need to learn how to use it, manage it, and then develop it. So that's the truth that we're living in right now. All right, moving on to the future vision. Because innovation isn't just solving today's problem, it's about anticipating tomorrow's as well. So AI is already changing the way doctors work, but the real promise lies ahead in supporting smarter decisions, improving outcomes, and reimagining the future of care, right? And then the challenge, which we can also see as the opportunity, is to guide AI in a way that doesn't replace us, but empower us, meaning like better care for the patients and a greater purpose for the providers. So Milton, tell us, where do you see that intersection of AI and then clinician support going next? Do you see any predictive analytics, real-time clinical decision support? And are those already part of your roadmap?
Yeah, Becky, I appreciate the question. In fact, I think we're going even one step further. So if I were to predict what the future of AI will be, so today AI tend to be this monolithic, right? You're in the ChatGPT world, you're in the Google world, and so on, right? So I think what the future of AI will be a set of Lego-like building block that you could dynamically link them together. So for example, like here's using Tele911 example, right? Here's initial patient assessment, you have decision support building. But what about there's an image in this that you can activate this AI module, analyze this image because there are technology from like portable X-rays and stuff. There's a lot of these sort of devices in there. So the idea, what we see literally is assembling all these sort of AI modules that dynamically link together. Then when you link them up, that becomes a really powerful way to actually, again, sort of like express AI.
Okay. Yeah, AI is not just ChatGPT. We have like a lot other AI tools out there. Yeah, so it will be the combination. All right, Dr. Lazaro, what's next for Tele911 in terms of enhancing AI capabilities?
Well, we can't share all our secrets.
Of course not.
We can't, but we are quickly becoming a company that's AI first. We must, not out of want, but out of necessity, right? As a company like this continues to scale nationwide, and as we see our company become from a nice to have to an actual utility across so many states, it's a demand for us to go into an AI first model because we have to optimize for, like Milton said, 100 million patients now, right? And we want to do that responsibly and profitably, and we want to make sure that we do that with the best care as possible. So we're going to be moving with AI tools downstream and upstream. I can't share what the future holds, especially with the next few releases that we're super excited about. But what I've seen is AI has made us a better company, and AI is only propelling us into the future incredibly faster than what we expected, right? And because of that, we want to figure out how to continue to do more and more. Because the more AI we use, the more patients we see, the better outcomes, the better experience for them and for us. We all win, right? And that's why it's at our forefront.
100% agree. All right, we got another good question from Anthony Constanzo. At the health plan level, health plans are hyper-focused on database security. There have been several data breaches, which are causing challenges in accessing that data. So can you discuss at a high level what security levels that are being utilized in the solution?
So I think when it comes to security in this, right, I think the number one thing is you cannot take someone's word for it. You must have external auditor to go through that to keep you honest, if you will. So the thing I would look for is by this is a general advice to the audience member, right? The two things you must look for is, do they have a SOC 2 certification? That means, again, don't trust the company. It's just security is always is right. You go do 1,000 things correctly. There's one thing you forgot about it. That's your breach, right? You must have external. Then the second one is a FedRAMP high. So FedRAMP high is even a lot more stringent than SOC 2. Now, most of the hospital operate SOC 2. We normally recommend is you got to go up the extra level, because when you do that, again, these are all external audited, then you can sort of sleep better at night.
And also to your testament, Milton, I mean, we work with we work with over 140 health plans across the United States. We're our trusted partners for most of the Blues, part of Aetna, Cigna, Humana, right? So the fact that we bring you guys to the table is a testament to credibility. I love that Milton mentioned SOC 2 because that's the first thing they always ask, right? As a mainframe into the computing. But one of the things that we've realized is they talk to each other, right? And they know that if one has done the diligence and trust that Milton has produced a company with utmost security, then others do. And because of that, because of actually those security standpoints, which health plans they scrutinize quite a bit, right? Because they see their patients as their data. even though you're the one treating them, right? They make sure that they cross their T's and dot their I's.
Yeah.
But it's been easier having VSee because of the credibility, right? I mean, NASA uses them, right? Like, there's a reason why they talk to the space station with them. It's because it's secure, right? And I think we needed that, especially at a small company starting off, that needed credibility quickly, right? And they were able to provide that.
All right. Thank you so much. Also, thank you so much for the audience for these amazing, great questions. I love it. So, Dr. Lazaro, Milton, thank you both for your insightful perspectives. Before we wrap up, just one last thought. This is for the audience. So let me ask you this. How many of you wake up saying, today I will knock out 15 tasks on my to-do list? Or today I will make a change. So which one are you? Are you task-driven or passion-driven? Because with the appropriate use of AI, we don't have to be task-driven anymore. We can be passion-driven. We can be change leaders. We can give all these tedious and repetitive tasks to AI. So as human, we can focus on what truly matters: caring for people, building relationships, showing empathy, and most importantly, nurturing our own mental and physical well-being. So we can double down on our human skills that AI cannot replace ever. So that's exactly, we need to leverage AI in healthcare. And Tele911 and Dr. Lazaro, they are already showing us how to do it, by cutting documentation time from 15 to 1 minute, and then giving back 14 minutes in every patient encounter. So that means more care for the patients and also more purpose for physicians. So with that, I want to thank you again, Dr. Lazaro and Milton, for sharing your expertise and vision for the future of AI-powered healthcare. And I also want to thank all of the attendees for today for joining us. And we hope this discussion sparked new ideas and practical steps that you can apply to your own work. And lastly, a special thanks to our backstage team, Anne, Roma, and Kendra. They are here. You just don't see them. So they are making this webinar run so smoothly. So thank you. And then everyone, just a reminder, you will get the recording after the session. Also, you should see a survey after we end it. And this is very important for us. We read every single feedback, so please fill it out and let us know how we can improve. And if you like this webinar, please check out vsee.com/secrets for previous webinars. And finally, we look forward to seeing you our next webinar. And then until then, stay connected, keep innovating, and then let's continue shaping the future of healthcare together. All right, thank you, everyone. Bye. Bye, Milton. Bye, Dr. Lazaro.